Hello, I'm Dr. Amit Kale, Joint Replacement Surgeon, Pune. Now, the first question that is very common is when should be total hip replacement surgery done, or what is the usual age group? With the increased longevity of the implant and newer techniques like robotic hip replacement surgeries, the longevity of the implant has really increased, and we have a data where hip joint survives for almost in 96% of the cases more than 20 years. So the hip replacement surgery can be done at an younger age as compared to the previous data, and so any patient who is around 40 or more than 40 can undergo hip replacement surgery safely. Definitely, if the disease has occurred earlier and patient is completely disabled, then we may go and do hip replacement surgery at a younger age as well. Now, the second is what are the restrictions after my replacement surgery? So, yes, obviously, the hip replacement surgery, you are with the new joint and you are with artificial joints. So definitely there are certain restrictions that are always there after hip replacement surgery. The most important is to avoid any position on the leg in which there is likelihood that the hip will get dislocated. So what should be avoided? Sitting on the ground, sitting cross leg, or sitting with one leg above the other thigh. These positions should be avoided after total hip replacement. Secondly, any impact sport like table tennis, long tennis, badminton should be avoided. If you use your joint properly, then the life of the joint will be more. Third important question that I have got is what is the best joint? So there is nothing like best joint. The joint is chosen depending upon the age of the person, the bone quality, the disease he is suffering from, and after examining the patient, your doctor is the best guide to tell you which joint is better for you. There are different joints available, similarly different designs are available. There are different materials which are available for the total hip replacement, and depending upon your condition, your bone and your bone quality as well as the disease that is why you are undergoing the surgery. Considering all these things, we can suggest you the best joint which is personalized rather than a general statement like this is a best joint. In a younger patients, it is better to go for uncemented joints, and in the old patients, usually we do a cemented hip replacement. One more question that patient always asks me is whether I should go for a robotic hip replacement or non-robotic hip replacement. Now, answering this is slightly tricky because few years ago, most of the hip replacement surgeries in India were non-robotic, and we definitely have very good results with even non-robotic hip replacement surgeries. With advance in the technology, currently we are doing most of our joints with the help of robot. Now, what is the advantage of robot over non-robotic surgeries? The most important advantage is an accuracy. So with the robotic surgery, we can accurately place the components of the joint in the human body, and the accuracy is improved with the help of robot. Second important thing, which is very important in especially in the hip replacement surgery, that is the limb length. So after replacement surgeries, few millimeter of discrepancy in the both limbs may occur. Now we can reduce this limb length discrepancy with the help of the robot. So patient may feel more natural post surgery if we go for a robotic hip replacement surgery. So these are the advantages of having robot as an assistant to a skilled surgeon when he is performing surgery. Robot is not a replacement for a good surgeon, but definitely it's an helping hand to improve the patient outcome.